This is the Educare module on mobility with focus on positioning. My name is Nicole Rennie. I'm a physical therapist and geriatric certified specialist in physical therapy. I've been a physical therapist for over 20 years. I own my own company in the Twin Cities metro area. I'm excited to help you today learn some keys to positioning.
I'm Jean Howell and will be the co-facilitator for this module. I have more than 35 years' experience as an RN working in assisted living, home care, and clinics.
Some of the things that we're going to cover today include why it's important to reposition clients. We're also going to focus on safety for both the caregiver and the client. We're going to review some of the common bed positions that caregivers place clients in, and we're going to understand when more than one caregiver is needed to position a client. So what is the purpose of repositioning? Many of older adults cannot change their position. Just think about how frequently during this presentation you have changed the position in your chair. It is our responsibility as caregivers to help older adults become more comfortable and change their position. When a person doesn't move, the blood begins to pool in the area that they're sitting on or laying on. This pooling is what leads to skin breakdown and open areas. So repositioning a client allows circulation back into that area that has been laying on and reduces the risk of skin irritation and skin breakdown. So let's talk about positioning. There are traditionally two positions: a person lying on their side, either their left or the right, and then also on their back. I'm going to be talking about the basics of positioning. There is not an exact precise position that every client should be placed in. Everybody has their own preferences and we should accommodate for those. The most important thing about positioning a client is that they're repositioned slowly and told what is going to happen before it occurs. As able, encourage the client to use only one pillow for their head. Using only one pillow will help in the future with swallowing and breathing. And then always ensure the client is comfortable before you're walking away. Let's talk about safety. It's of the utmost importance that caregivers that you protect your back. The earlier you begin good body mechanics, the longer you'll be able to participate in your current job. What causes people to get out of work and to have bad backs is poor posture and repetitive movements throughout their whole entire lifetime. The younger you are, the more important it is to start with good body mechanics. Here are some basic tips. Adjust the height of the bed to a comfortable position. The height of the bed should allow the caregiver's back to be as straight as possible to minimize the amount of bending you're doing at your trunk. I myself am quite tall, so what I do is I place my knee on the bed to help keep my back straight with repositioning and other activities. Again, these are just some of the basics. You need to find what works for you, but it's essential that this is an important focus throughout your day. And just as a side note, it's important to have all your positioning equipment and pillows ready prior to beginning the process. Let's talk about some positioning standards. It is recommended that a client is repositioned in bed every 2 hours. Research has shown that repositioning a client every 2 hours decreases the risk of open areas and sores. However, it's important to reference the client's specific care plan. Clients who have a history of open areas will most likely need to be repositioned more frequently. When repositioning a client, it is essential that the caregiver inform the client what they're going to do prior to moving them. Informing the client will decrease the risk of injury to the caregiver and the client. The client will also cooperate more with the repositioning. Oftentimes, the clients will give you hints or tips on how to reposition them more quickly and more comfortably. That is why communication is the key. Let's talk about how we move a client from their back to their side. A client will have a preference on whether they like to lie on their left or right side. Please refer to their care plan to see if there is a preference or if they need to alternate sides. The caregiver will assist the client with bending their knees and placing their feet on the bed. This position makes it easier for the caregiver to roll the client onto their side. Once the knees are bent, the caregiver will place a pillow between the client's knees. Placing the pillow between the client's knees prior to rolling them on their side is much easier for both. The caregiver will not have to lift the client's leg up to place the pillow in there. They'll just have to readjust it once the client is on their side. The purpose of the pillow between the knees is to stop the client's knees and ankles from touching. The pillow also provides support for the client's low back. The caregiver assists the client with rolling onto their side. Then you readjust the pillow between the ankles and the knees to make sure that they're not touching. Remember to ask the client if they're comfortable and if they have any pain. Once the lower body is positioned, the caregiver will place 1 to 2 pillows behind the client's back and buttocks. This will help the client stay on their side. I strongly recommend that you place the pillows under a draw sheet. This will help keep the pillows in place. Roll the client back onto the pillows and make sure they're comfortable prior to walking away.
Before we watch the video, let's review the position from back to sideline procedure. Number 1, adjusted height of client's bed to keep their back straight. Number 2, caregiver had pillows and other positioning equipment ready prior to starting. Number 3, inform the client what they were going to do prior to moving them. 4, reposition the client slowly. 5, requested help from another caregiver if the client was difficult to position or if the client's limbs were too heavy to move safely on own. Number 6, caregiver was mindful of body mechanics, keeping the back straight, minimized bending, place knee on bed if needed to keep the back straight. Number 7, caregiver assisted client in bending knees prior to rolling. Number 8, placed a pillow between the client's knees prior to rolling. Number 9, ankles and knees didn't touch when positioning was completed. Number 10, placed pillow behind client's buttocks and back under a draw sheet if present. And number 11, document the care.
We're actually going to roll onto your side. Is the right side okay? Okay. So I'm going to bend up your right knee. I'm going to bend up your left knee. And I'm going to put a pillow between your legs to make it easier. So what position do you want this arm in?
Straight out.
Straight out? Okay. Now we're going to roll towards your right. Do you want a pillow for your head or not?
No.
Okay, here we go. 1, 2, 3. We're going to roll. How's your arm?
Good.
You want it there? How you feeling?
Good.
Okay. I'm going to pull this leg forward a little bit. Give you better balance. Okay, I'm going to roll you back just a little bit. How does that feel?
Good.
You can stay there for a little bit? Okay. Let's discuss how we move the client from side lying back onto their back. The caregiver removes the pillows that are behind the client's back and buttocks. Keeping the pillows between the client's knees, the caregiver assists the clients in moving their bent knees from the side to a position in which the knees are pointed towards the ceiling. It is much easier to roll the client when their knees are bent. Once the knees are pointing towards the ceiling, the caregiver will remove the pillow between the client's knees. The caregiver will then assist the client in slowly straightening their legs. Please remember to notify the client what you're doing prior to doing it.
Let's review the position from sideline to back procedure. Number 1, adjusted height of client's bed to keep their back straight. Number 2, caregiver had pillows and other positioning equipment ready prior to starting. 3, inform the client what they were going to do prior to moving them. Number 4, caregiver removed back and buttock pillow prior to rolling. Number 5, kept pillow between client's knees when rolling. Number 6, caregiver assisted client in moving bent knees from side to a position in which the knees were pointing toward the ceiling. Number 7, repositioned the client slowly. Continuing with the procedure, number 8 is requested help from another caregiver if the client was difficult to position or if the client limbs were too heavy to move safely on own. Number 9, caregiver was mindful of body mechanics, keeping back straight, minimized bending, place knee on bed if needed to keep the back straight. Number 10, remove pillow between the client's knees after client was on back. Number 11, assisted client with placing legs on the bed. Number 12, placed pillow under the client's calves to keep ankles off the bed. Number 13, client's ankles were extending over the edge of the pillow. Number 14, made effort to place client as flat as possible when positioning was completed. Number 15, if client complained of back pain, placed pillow under the knees. And last, number 16, document care.
So Jenny, it's time to get back on your back, okay? I'm going to take the pillows out from behind your back. Sorry about that. So we're going to roll onto your back. I'm going to keep your knees bent. You ready? 1, 2, 3. Tell me if it hurts. I'm going to take the pillow out. Now I'm going to straighten your legs. Do you have a preference which one I put down first?
The right one.
Any pain anywhere? How do we position a client lying on their back? The first thing we need to do is place a pillow under the calves to help keep the client's ankles off the bed. The client's ankles should not be touching the bed or the pillow itself. If the client's ankles are touching the pillow, their chance of breakdown or open areas on their ankles actually increase. It's important that the client is lying as flat as possible. We discussed earlier about the benefits of only using one pillow. The client may need a pillow under their knees to reduce their back pain. Remember to communicate with the client as they may have tips or suggestions on how to make them more comfortable.
Before we watch the video, let's review the back lying procedure. Number 1, adjusted height of client's bed to keep their back straight. Number 2, caregiver had pillows and other positioning equipment ready prior to starting. 3, inform the client what they were going to do prior to moving them. 4, caregiver lifted each leg separately and placed them on a pillow. Number 5, caregiver positioned pillow to keep the client's feet off the bed. 6, caregiver placed a small pillow between the client's knees to keep the knees apart. Number 7, caregiver ensured that the client was comfortable. And number 8, document care.
So Jenny, we need to put your ankles up on a pillow for a little bit to get them off the bed. Okay? So I'm going to lift up your right leg. And also your left. Just want to make sure your ankles aren't touching. I'm actually going to put a small thing between your knees to keep your knees apart, okay? How's your upper body feel?
Good.
Okay, you're comfortable. Sometimes 2 caregivers are recommended when repositioning a client. The most common reason is when one caregiver is struggling with positioning the client on their own. I can guarantee that we would prefer that you would ask for help rather than injure yourself moving the client on your own. Another reason 2 caregivers is recommended is when the client's limbs are too heavy for the caregiver to move on their own. Please remember that your safety is very important. If you do not feel comfortable repositioning a client on your own, it is okay and recommended that you ask for help. Caregivers, it's important that we continue to communicate with nursing, especially if you're noticing changes with the client itself when it comes to positioning. The nurse should be told if the client is becoming more difficult to position because they're more stiff or rigid, or they're complaining of pain during the positioning process. It's also important to tell the nurse if the client cannot get comfortable. Please be aware if you notice any red areas on the client when you're repositioning them that you notify the nurse immediately. Please remember when you're repositioning a client that your body mechanics are extremely important. It is essential during repositioning of a client that you're aware of your own body mechanics. Protecting yourself and your body is important for your own health and well-being. Also remember that when you're moving a client, you move them slowly and notify them of what you're doing prior to moving them. This will help reduce injuries for yourself and for the client themselves.
We'd like to thank you for your time. Please ask your RN if you have any questions. And when you are ready, please complete the knowledge and demonstrated skill assessments.